अस्सलाम वालेकुम गाइस। आज का हमारा टॉपिक है एनाटॉमी ऑफ द ग्लूटियल रीजन। इस लेक्चर में हम ग्लूटियल रीजन के क्वाड्रेंट पढ़ेंगे और ग्लूटियल रीजन की फेशिया पढ़ेंगे। सो वी स्टार्ट द लेक्चर। Gluteal region anatomy. Gluteal region are also called buttock region is formed by the gluteal muscle and the thick layer of the superficial fascia. ग्लूटल रीजन क्वाड्रेंट ग्लूटल रीजन हमारे पास को 4 क्वाड्रेंट में डिवाइड हो गया है। वन इज द अपर मीडियल क्वाड्रेंट, सेकंड वन इज द अपर लेटरल क्वाड्रेंट, द थर्ड वन इज द लोअर मीडियल quadrant, and the fourth one is the lower lateral quadrant. You can see that this is the gluteal region or the buttock region. They are divided into 4 quadrant. One is the upper medial, the second one is the upper lateral, the third one is the lower medial, and the fourth one is the lower lateral. Now we will see the nerve supply of each region of the gluteal. So the upper medial region quadrant is supplied by 3 lumbar nerves and the 3 sacral nerves, while the upper lateral quadrant of the gluteal region is supplied by iliohypogastric nerve and T12 in the T12 thoracic nerve. Very important for MCQs. Remember these nerve supply for the gluteal region quadrant. Now coming to the lower medial is supplied by the posterior cutaneous nerve of the thigh, and the lower lateral is supplied by the lateral cutaneous nerve of the thigh. So that is the nerve supply of the gluteal region quadrant. Now coming to the fascia of the gluteal region. The fascia of the gluteal region has divided into two. One is the superficial fascia and the second one is the deep fascia. The superficial fascia is thick in women and large due to the large quantity of fats. जो superficial fascia होता है ये women में थिक होता है और ड्यू टू द लार्ज क्वांटिटी ऑफ फैट्स, क्योंकि इधर इसमें फैट्स की मिकदार बहुत ज़्यादा होती है. Now coming to the deep fascia. The deep fascia attach with iliac crest above and the lateral condyle of the tibia below. It runs laterally and become the iliotibial tract. Now coming to the diagram, you will understand betterly. You can see this structure. This structure is the iliac bone, and the upper side is called the iliac crest. This structure is called the iliac crest. Now you can see this is the deep fascia. The deep fascia attach above with the iliac crest. You can see here, and the below they are attached with the lateral condyle of the tibia. This is the lateral. This is the lateral condyle of tibia, and they runs laterally on the tibia bone. You can see they runs lateral side on the tibia bone and become iliotibial tract. Iliotibial tract, which is important for the attachment of the tensor fascia lata. Tensor fascia lata is insert in the iliotibial tract. So this is the deep fascia. The deep fascia is attached above with the iliac crest and they attach below with the lateral condyle of the tibia. They runs laterally and become the iliotibial tract, which is important insertion for the tensor fascia lata muscle. So that is all about the today lecture. So please subscribe my channel and press the bell icon for more video notification, and we will continue the gluteal region part 1, part 2, part 3, and part 4. So in the 4 video we will cover the gluteal region, and part 5 is the gluteal region MCQs we will discuss in the part 5. So you watch this lecture and all the part of the gluteal region. Thank you.